Hey Rukia, hey Kiani, how are you guys?
Hey Thomas, I'm doing good. How are you?
Oh, tired. Is the semester done for you guys?
Oh, oh yeah. Well, I'm not in school anymore, so I'm glad.
Oh, good, good, good,
Yeah,
good.
but you're almost there. You got it.
Well, I'm not teaching this semester, so I that's what I was asking. I'm like, I don't even know. Like, I've just been working, but
Oh yeah, I think tomorrow is the
yeah.
last day for everybody.
Okay.
Yeah.
Um, Rukia, can you put the slides up? Share the slides, please. Sorry, I'm on my phone. I'm still at work.
Yes, no worries.
Thank you. Let's see who's on. Hey, good afternoon, James. Haley, thanks for joining, both of you. Hopefully we'll get a few more. I'm expecting more because of what's going on with Omicron, but we'll wait and see. No, take off my mask just a little bit. I'm wearing a mask. I'm inside right now. Okay, we'll get going, and hopefully we'll have a few more. Yep, no changes to what we're going to talk about. Next slide, Rukia, please. So these slides are a little old. Apologies for canceling last week. I was knee deep in the Red Hill water contamination response, which I'm not going to talk about because I'm on active duty for that. But you can see Japan is definitely staying constant at a very low level. To be determined when and if Omicron is going to have an impact there. Next slide, please. Korea, unfortunately, is continuing to trend up. They've further implemented restrictions and travel restrictions. But once again, of note, relative to other countries, their absolute numbers are still not nothing compared to United States, England, France, etc., Spain. So this is their major spike. Next slide. India, yeah, they got hit hard with Delta. They're relatively close, to Africa in terms of distance, but we'll see. I'm curious. We're still waiting to see, if you had natural immunity to Delta, what that would do for infection against Omicron. So, there's still a lot of variables left to be determined when it comes to Omicron. Next slide. So, trending up, but it looks like we're plateauing once again. I don't foresee this staying our plateau. I expect to see an increase nationally, just because of the potential for reinfection due to Omicron. So we'll wait and see. Hopefully, our vaccination efforts continue, as well as do the boosters. And I'll discuss the boosters in the science highlights. Next slide. So Arizona, California, you have up and down trends. Once again, it is still too early in terms of the impact, any significant impact to see on an epi curve for Omicron yet. So, hopefully, in a few weeks we'll have a better sense of the impact to our country. Next slide. Same with Nevada and Texas. Texas trending up, but once again, it could be the holidays. People are gathering more. It's too hard to tell what the causation is. Next slide. Hawaii trending up. I mean, as you can see, we've had triple digits for close to the past week. 300 over 300 today for the first time since the initial Delta surge. So not good, however, not bad either. And Monique and I were on Hawaii News earlier this afternoon, and it's worth reiterating, continue to reading that the case counts now, taking more of the grain of salt because of how vaccinated our population is, and what little we know about Omicron in terms of the severity of disease that it leaves. So more to follow on our science highlights. Next slide. Vaccination continued to do well relative to the other states. And we are one of the more boosted states, which bodes well for Omicron. We're seeing the boosters are are a good in terms of antibody levels, keep us protected. Next slide. So our Hawaii forecast, if you notice, looks a little different. However, it is incorporating more and more accurate analysis. You can see, you know, all our pessimistic and our best fit and our optimistic all point to as the beginning of an exponential increase, barring any drastic further mitigation efforts. So once again, cases is not something I'm, from my perspective, an epi perspective, I'm as concerned about. It's more the hospitalizations. You know, we are projecting an uptick of hospitalizations, but this is a more conservative estimate, you know, in terms of, you know, our assumptions on the proportion or percentages of cases that end up being hospitalizations. You know, we still don't have definitive data yet on what that looks like for Omicron versus Delta. Next slide. Once again, this is just the same slide, previous slide in numerical format. Next slide. So, man, I did this last week. We know so much more, yet know so little bit, and so much has changed. So, you know, I wanted to highlight what we knew last week about Omicron and what we've learned this past week. Pfizer's booster, CDC revised guidance on boosters. Obviously today, CDC is recommending something different for J&J now. And then WHO updated Omicron and vaccine efficacy against Omicron. So we'll go through this, and, you know, but there's a lot that has changed since last week on what we know about Omicron and the boosters. Next slide. So the next few slides, I just want to highlight you know, last week we weren't really sure whether or not Omicron would overtake Delta as the dominant variant. I think it's apparent now that it will, but last week we weren't quite sure. But I just want to show, this is South Africa. It's quite apparent that Omicron, the red color, was rapidly overtaking Delta, you know, and I wanted the group to just compare South Africa with I think I put United States. So next slide, please. And this is just the South Africa's vaccine population. As you can tell, it's only 30%, at least 30% partially vaccinated, with a 25% fully vaccinated population. I want you to keep that in mind as you compare that with the United States. Next slide. So as you can see, in the United States, as of last week, you know, Delta is still the dominant strain. You know, we were seeing an uptick. You know, I didn't check this week. I expect Omicron to continue to increase. You know, it is more infectious than Delta due to the mutations. However, you know, it's the severity and disease, severity of symptoms that really we're most concerned about if it is more severe, and it doesn't appear to be so far. Next slide. And then our United States as a whole, 71% at least partially vaccinated. I think that says 60% fully vaccinated. So we're more than double the fully vaccinated population of Africa. And I think that's an important note as we continue to kind of look for correlations or extrapolations comparing, you know, what's going on in South Africa and UK versus what might happen in Hawaii and the United States. My hypothesis in terms of is that the vaccinated impact of vaccines are going to have a huge positive impact on risk reduction for Omicron, at least based on what we're seeing. Next slide. So what do we know now? You know, it suggests it's more infectious, and we're seeing that play out in the number of cases of Omicron in South Africa. I think so last week I said it was too early. I think at this point we're feeling more confident saying that the disease severity is similar, if not more, a little milder compared to Omicron. And the reason why we can say that is while there was an uptick in hospitalizations in South Africa, majority of them were due to underlying conditions and not solely due to Omicron. And that's positive because of, you know, if you consider how under-vaccinated South Africa's population is, and yet their hospital systems, at least as of now, isn't yet overwhelmed, you know, that bodes well potentially for a highly vaccinated population such as Hawaii. So, you know, we're still watching it, but in terms of ultimately keeping people out of the hospital and keeping people from dying, Omicron is looking to be one that is less severe than Delta. Next slide. So Pfizer came out last week with a small study that showed that a booster, a third dose of of Pfizer increases antibody levels and therefore increases protection against Omicron. So so strong push for boosters. Next slide, please. So CDC updated their recommendation last week that everybody 18 and older should get a booster shot. Next slide, I believe if you got Pfizer, Moderna, if you're at least 6 months post your second shot, recommended to get a booster of either the same or mixing and matching is allowed. And if you got Janssen or Johnson & Johnson, you should definitely get it 2 months after completing vaccination. And then, want to acknowledge what came out today in the news that CDC is recommending, I think CDC is recommending, or ACIP is at least, that the mRNAs are more effective and to get the mRNA over Johnson & Johnson, especially given some of the contraindications, the cardiovascular complications that have resulted in getting the one-shot Johnson & Johnson dose. So once again, mRNA is the recommended vaccine of choice, given what we know so far. Next slide. And then, once again, I wanted to put WHO and CDC are supposed to be the leading experts that we turn to. They were, as of last week, still on their website saying that the 2-dose mRNA is still sufficient against severe hospitalization and disease. And I don't think much has changed. We have seen a small study come out of South Africa a couple of days ago showing that the efficacy of the Pfizer, I think it was the Pfizer vaccine, dropped dramatically from 70% to 30%. But once again, this is efficacy against infection. And what we're most concerned about in our healthy population is the efficacy against severe hospitalization and death. And while that efficacy drops slightly, it's still well above the 70% threshold, which is still good news given the vaccine inequities across the world. But however, if you are in a state like Hawaii that has readily amounts of boosters, recommend getting a booster because while 2 shots is still effective against staying out of the hospital, if we have the ability to further protect ourselves with a booster, I recommend getting a booster, just because every individual is different with their risk calculus. Next slide. And so, once again, last week we still didn't know. We know a little more this week. Still don't know a ton, but I put this information out there because you're going to see a lot more, and we've seen a lot in the past about waning antibody levels and what that means for our immune response. But and I'm not an immunologist by any means. I defer to our colleagues, our other colleagues in HiPAM, but I think I know enough to suggest to the group that we have so many other tools in our toolkit in terms of our immune response, especially the T cells, that even though our antibody levels they naturally decrease after either natural infection or after a booster or after a course of a vaccine, which is what they're supposed to do. We have other mechanisms by which our body can successfully protect against viruses, and Delta not part of that. So while you'll see a lot in the media about waning antibody levels and boosters, we'll continue to have other means within our immune system to protect ourselves against Omicron and whatever variant comes out next. And then one other note, it didn't make it to the science highlight, but the early analysis in terms of the genetics and where the mutation occurred suggests that it's mutating more and more towards the common cold, which makes sense. It's more infectious, but it's definitely less lethal. And codes, it's still a coronavirus. So once again, more mutations isn't necessarily a bad thing. However, the possibility of it mutating to a variant that completely escapes the current vaccines is still possible, which is why we need to consider, prevention is still the best way to make sure that we don't create a variant that completely escapes the vaccine. And Jim, I see that you posted a question in the chat. Let me get to that. Yeah. So for everybody, if you're not able to read the chat, I'll read Jim's question. If Omicron proves to cause milder symptoms, the increased transmission rates could impact healthcare resources. Absolutely correct. Are there models that point us to the best mitigation measures from public health policy perspective? Should we be increasing restrictions to avoid overrunning healthcare? So great question. We're not in the business of making policy. But that is a great question. I think if you look at what we have in place in terms of Hawaii, current mitigation, and we still have safe travels, we still have mask mandates, or I think we do, or a lot of people still wear masks indoors. We have the policy where you have to be vaccinated or have a test within 48 hours to dine or access a lot of facilities indoors. Those still are great tools, mitigation tools. However, and continued vaccination rates as well. It's so hard to tell, Jim, what else we can do, and because we have to find that balance, the economic balance, the mental health balance of policy and best public health practice. And what I would say is, if the elderly population, the highest population is fully vaccinated and boosted, that should not prevent them from wearing a mask and still being protected and interacting in essential activities, and even some holiday festivities as well. I think at this point we have to acknowledge that we can no longer, and we have never been able to mitigate to the risk to zero. Yeah. Hey, Tom. Yeah, great point. Doubling time 2 to 3 days, much faster than what we expected. So still too early to tell. Our models are showing, Monique's work that we pushed out to the group, showing a pretty fast uptick in cases. But once again, taking that with a grain of salt, 500-600 cases in the next couple of days means something different than 500 to 600 cases during the Delta surge, right? Because of what we know about Omicron so far, and it could change. So don't take my word to the bank by any means, and I continue to monitor every day. But I think there's a lot of context that should be added when it comes to just interpreting case counts versus looking at the impact on hospitalization. Yeah, Jim, we definitely do model restrictions. So if you look at the comparisons Monique's team did, we look at what it would look like unmitigated versus with current mitigation. So definitely we do factor that into the products that we share with the community. Great point. Let's see. Any other questions, comments? All really good. Hey, Adrian, thanks for joining. Good to see you. Sorry, it's been a crazy week with a lot of stuff, but and it's been a while since seeing at HiPAM, but good to see you. And then what I will add, and we've touched upon this in last month, is I think the FDA is very close to approving under EUA Pfizer's antiviral pill, which is given based on what we've seen so far, is going to be another tool in the toolkit to further mitigate cases. Once again, prevention is the best method, but if you are to be infected, even if you're a breakthrough case, we have more tools in our toolkit than we did with Delta to prevent symptoms from progressing to even worsening levels. But not so great for unvaccinated population, are hoping for mitigation. Yeah, so once again, while our treatments continue to evolve and improve, I'm preaching to the choir. Vaccinations are still the best way to mitigate massive risks to the population and yourselves. But working with Monique, we'll continue to look at the genetic data, the virologic data, efficacy data, and obviously Hawaii's real-time data, and refine our assumptions and continue to improve our modeling and share if there's anything major. We'll definitely share that with the group. If you have any questions, please email HiPAM. We'll be happy to get to them. But we always appreciate everybody's participation. I know we've kind of ramped things down to once a month, but if anything crazy comes up in Hawaii, we may increase it. I know it's a holiday season, so there's a lot of competing requirements for everybody. Everyone wants to enjoy, which you should. It's been a long couple of years, but if there's anything major, we'll send out an email note and for another Thursday webinar. Thankfully, it doesn't fall on Christmas or New Year's Day or New Year's Eve or Christmas Eve. So, we'll be sure to keep you all informed if anything major comes up. But if not seeing anything else in the chat, wish you all, if I don't see you until the new year, a very happy holidays and a new year, to you and your family, and stay safe. And we'll see you all in the new year, which means that nothing crazy has changed from now until January. But yeah, have a great couple rest of 2021. It's crazy, but we'll see you all in 2022. Take care, everybody. Thank you for joining.